So welcome to the part 3 of the lower limbs. So today we are going to start with the leg region. So what is the leg region? So leg region is basically from knee joint till the ankle joint. Ankle joint. Okay, so this is the leg region. So basically the leg region consists of three compartments: the anterior compartment, the posterior compartment and the lateral compartment, as we have discussed earlier. So going forward in the lower limb, so this anterior, posterior and lateral compartment and the respective muscles of the compartments. So while teaching the anterior compartment, so we will starting with the anterior compartment basically. While teaching about the anterior compartment, the muscles are not identified directly in the anterior compartment. So basically how they are identified? So when we look in the front of thigh, the medial side of thigh, we look about the muscles, like if we hold the muscle, we see the origin, the insertion, and we get to know that this is that muscles. So like the sartorius originates from the ASIS and go to the patella. So basically it goes obliquely from the lateral to medial side, and also it forms the boundary of the femoral triangle, so we can identify it as the sartorius. But this case is not in case of the leg. So in the leg region, basically what happens is the tendons of the muscles play a pretty much important role. So what are these tendons? So basically what happens, there is a retinaculum. So retinaculum is basically a thick fascia. It is a deep fascia, modification of the deep fascia, a thickened band of deep fascia which encloses the tendons of the leg region. So what happens basically, we see the relations of the deep fascia or the retinaculum. In case of anterior compartment is the extensor retinaculum. So with the relation, we see the relations of the extensor retinaculum and we get to know what is the muscles. So the tendons are present beneath the deep fascia or the retinaculum. Okay, the under the retinaculum the tendons are present. So by the relations of the tendon we get to know which muscles is that. So the relations of the retinaculum is very much important. So starting with the anterior compartment, we will start with the retinaculum region. Okay, so first, since the anterior compartment is the extensor compartment, the retinaculum is also known as extensor retinaculum. So what is this retinaculum? So extensor retinaculum is basically thickened band of deep fascia. Okay, and in case of extensor retinaculum we get two bands of deep fascia. So basically it is the superior extensor retinaculum. Let me write it too. Superior extensor retinaculum and the inferior extensor retinaculum. So now starting with the retinaculum, first we will see the attachments of the retinaculum. So since we are talking about the anterior compartment, so first we will draw it, how the anterior compartment looks. So basically we will first draw the bones of the anterior compartment. So bones of the anterior compartments are tibia and fibula. Okay, so basically tibia is medially. So we will discuss about the right leg. Okay, so for the right leg I will give you the orientation of the figure. The superior and inferior remains the same. For the right leg, the medial and the lateral, we are looking at the figure, so the medial will be on the right side. Okay, so let me draw the two bones at the first. So basically we are drawing the lower end of the tibia and the fibula. Okay, just some distance. Okay, so this is the lower end of tibia and fibula. Now first I will draw the attachments, and then I will tell you what is the attachment theoretically. Okay, so now the superior extensor retinaculum. The superior extensor retinaculum is basically attached like this. It is a single band. Okay, and the inferior extensor retinaculum is basically attached like this. It is a Y-shaped band. Okay, like it extends backwards. Let me show you the extension also. So basically it is like this, encloses the tendons and go backwards. And also another, the Y, it is Y shaped, so another band is present. So these are the attachments. So what are the attachments? We will write the attachment. I will write in short, superior extensor retinaculum. So what are the attachment? Medially. So medially we can see the anterior border of tibia, and what we can see laterally, the anterior border of fibula. So these are the attachment of the superior extensor retinaculum. What is this? This is the inferior extensor retinaculum. So what are the medial attachment? So medially we can see two attachments. Okay, so basically the first attachment is the medial malleolus. Okay, so basically the lower end of the tibia, and another attachment of the medial side is this, the other Y band, the Y stem of the inferior extensor retinaculum is the deep fascia of sole. So basically it is not attached to any bony prominence, but it is attached to the deep fascia of the sole. Now the lateral boundary, so the lateral like where it is attached, lateral insertion of the extensor, inferior extensor retinaculum, basically the stem of Y is calcaneum. So laterally the calcaneum is attached, so therefore it encloses the tendon. It does not attach to the fibula, basically it goes backwards and it attaches to the calcaneum. I can't show calcaneum here because it will be a bit very complicated diagram. So basically this is the basic attachment of the retinaculum. Now coming to the relations of the retinaculum. So basically first I will draw a bit, just a second. Okay, so now I have purposefully drawn the distance more between the tibia and the fibula, as we have to show the figure, the diagram. So just the retinaculum. Okay, so basically somewhat like, just a second. Somewhat like this is the retinaculum. Okay, so here it is a mnemonic to remember the relations. Okay, so the mnemonic says tall Himalayas are never dry places. So what is this mnemonic? So basically when we see the retinaculum, the extensor retinaculum basically, so when we say this mnemonic, tall Himalayas are never dry places, so basically these are the relations underneath the extensor retinaculum. So what are this? The tibialis anterior from tall Himalayas, the extensor hallucis longus. Then the artery is the anterior tibial artery. The nerve, never is nerve, it is deep peroneal nerve. Dra is extensor digitorum longus, and places is peroneus tertius. Okay, so these are the relation. Okay, these are the relation from medial to lateral. So we will draw that. So first, underneath it is the tall. Okay, the tibialis anterior. Then it is important to draw this Himalayas are never relation, or the extensor hallucis longus, the anterior tibial artery, and the deep peroneal nerve relation. So basically what happens, it is somewhat like this. Please, you should show this curve. Okay, the curve of this extensor hallucis longus. Now artery. Now the artery above the retinaculum, it is like this, and when it is come into the retinaculum, it comes like this. Okay, the anterior tibial artery. Then the nerve, also the nerve is like this, and in the retinaculum it comes like this. Okay, then the extensor digitorum longus. So the extensor digitorum longus is a pretty much bigger tendon. So basically it comes like this, and then it divides. So basically it comes like this. Okay, and then it divides into 4 tendons. Okay, and then the peroneus tertius. Peroneus tertius is a little tendon. Just a second. It also comes like this. It goes in this slip, and then it goes like this. Okay. So we will label them now. So basically this one is peroneus tertius. This one is the extensor digitorum longus. Okay, this one, let me label it here. It is the deep peroneal nerve. This one is the anterior tibial nerve. Okay, this tendon is the extensor hallucis longus, and this tendon is the tibialis anterior. Okay, from medial to lateral, let me just medial lateral. It is tall Himalayas are never dry places. The mnemonic, just highlight that mnemonic. Okay, so tall Himalayas are never dry places. Tibialis anterior, extensor hallucis longus, then the anterior tibial artery, deep peroneal nerve, extensor digitorum longus, and peroneus tertius. So this was all about the extensor retinaculum. Okay, so when we try to look the muscles in the cadaver of the leg, so basically we will see the relation of the extensor retinaculum from medial to lateral, and then we will determine the muscle. Okay, then one applied part is the Fresher's syndrome. So basically what happens, since the anterior compartment is like, it is concerned with the extension of the extension of the leg. Okay, so what happens when now this syndrome is known as Fresher's syndrome, because like in your colleges, like in ragging kind of thing. So what happens in ragging, if like the seniors, they tell the juniors to run 10 rounds or 20 rounds of the college or somewhat like that, so extension of the leg occurs. Okay, so that extension can cause too much pain. Okay, due to the, as sudden exercise is done. Okay, so this is known as Fletcher's syndrome. So due to sudden exercise, the anterior compartment of leg tends to get pain. Okay, this is known as Fletcher's syndrome, or also the anterior tibial compartment syndrome. Okay, so this was all about the extensor retinaculum. Now, when we talk about the leg, so we have completed the anterior compartment. So anterior compartment is this relations of the leg. Now we will come towards a bit like to the flexor retinaculum basically. So flexor retinaculum, it encloses the tendons which are coming from the back of the leg. Okay, so the reason why I'm discussing this retinaculum early, as like retinaculum is a topic where you should know all the relations. So if you know the relations of the flexor retinaculum, it will be easy like to know the muscles of the back of the leg. Okay, so now we will look at the flexor retinaculum. Okay, so let me just draw it. So basically we are looking at the right leg, and you will wonder what is this. So basically, for example, if a man is standing like this, for example, okay, this is his right leg, so the left leg will be overlapping. Okay, so if we remove the left leg and if we take a section, okay, like this, like we have seen this left leg, right leg, the medial aspect, if we like just cut the superficial layer, just a second, if we just cut the superficial layer, okay, this one, okay, and then we are seeing this, for example, if we cut the superficial layer, then we will look like this, for example. So basically you are looking at this region. So what is this? So this is the end of, or basically the medial malleolus, to be more specific. Okay, what is this? This is the calcaneum, the calcaneum bone. So basically what is this figure, like here it will come the navicular, then the medial cuneiform, then the first metatarsal, then we will see the distal phalanx and all. Okay, so basically this is the leg. Okay, not too good, but to understand the flexor retinaculum, this much portion you should draw. Okay, so basically I will first draw the retinaculum. So basically this is the retinaculum. The flexor retinaculum is attached like this. Okay, so now let us draw the relation underneath the, just a second, just so this is the medial malleolus, the calcaneum. So the flexor retinaculum. So while talking about the flexor retinaculum, the tendons which go underneath, okay, it is a bit confusing kind of thing, like the relations of the tendon above the retinaculum, below the retinaculum, inside the retinaculum. Inside the retinaculum we can definitely like remember it with the help of mnemonic, but it is equally important to draw the relations which are upper to the retinaculum and lower to the retinaculum. Okay, so now as we have seen the mnemonic for the tendons which are passing deep to the extensor retinaculum, we also have a mnemonic So just I will write the mnemonic in this corner. So the mnemonic is the doctors are not here. Okay, the doctors are not here. So from T it is the tibialis posterior. From D it is the flexor digitorum longus. From A is the artery. Which artery? The posterior tibial artery. From N is the nerve. Which nerve? The tibial nerve. Okay, and from H it is the flexor hallucis longus. Since the tendons from the back of the leg are all the flexor compartment, so the flexor tendons are coming in this region. So from T we say the tibialis posterior. So now while drawing the tibialis posterior tendon, okay, remember you have to draw like this. First tendon to go like this. Okay, now D, flexor digitorum longus. It is also means like it is a thick tendon or a long tendon. Thick and long, both the tendons. Okay, now how to draw it? So basically you have to draw it like this. It should come like this and then acquire the second position, and it should go more downwards. Okay, in the sole like region. Okay, now the artery. How to draw the artery? Artery is pretty much simple. So basically the artery is like this. Okay, then the nerve. Nerve is also pretty much simple thing. So basically nerve divides the lateral plantar nerve and the medial plantar nerve. Okay, then the tendon. Okay, the last tendon, the flexor hallucis longus. So you should draw the tendon like this. Okay, it extends above the flexor digitorum tendon. So let me label it. Okay, the first tendon, which is this tendon, which goes to acquires the second position, is the flexor digitorum longus. The tendon which is acquiring the first position, the tibialis posterior. So tibialis posterior is the first, flexor digitorum longus. Then the artery is the posterior tibial artery, the tibial nerve, and the flexor hallucis longus tendon. Okay, so this was the relation of the flexor retinaculum. The tibialis posterior, the flexor digitorum longus, then the artery. Which artery? The posterior tibial artery. Then the nerve. Which nerve? The tibial nerve, and the flexor hallucis longus. So let me highlight this mnemonic for you. Okay, so this was all about the flexor retinaculum. So now we should head to the back of leg. Okay, the back of leg. So back of leg is the flexor compartment. Okay, flexor compartment of leg basically. So like we have mentioned it earlier, the gastrocnemius two heads, then the soleus, then the tibialis posterior, flexor hallucis longus, and flexor digitorum longus are the muscles present in the back of leg. So now basically we have to draw one diagram to show the muscles. It is a very pretty much easy diagram. So now we are looking at a section. Okay, looking at a section of the left leg where we have cut the leg, like we have, just a second. So basically, for example, this is a leg. Okay, we have cut this leg like this. Okay, and our eye is here. Okay, and we have cut it like this. Okay, we are seeing the left leg. So this will be the medial, lateral, superior, inferior. So we will see a cut section of the tibia. Okay, cut section of the tibia, also the cut section of the fibula will be seen. Okay, so we will go like from deep to superficial. Okay, it will be pretty much more easy and more sensible too. Okay, so in the deepest muscle on the medial aspect we have the flexor digitorum longus. Remember, my trick to remember, flexor digitorum longus is a good muscle, so flexor digitorum longus is more medially. For me, medial side is the most good side. Okay, in the middle we have the tibialis posterior. Okay, we will follow 3-1-2 rule. Okay, we also know that 3-1-2 is basically the primary somatosensory cortex. So in the inner side we have 3 muscle, in the middle layer we have 1 muscle, and the superficial layer we have 2 muscle. Okay, so let me just first label it. This is the flexor digitorum longus, this is the tibialis posterior, and more laterally we have this muscle which is known as flexor hallucis longus. Okay, so let me just label it flexor hallucis longus. We said we will follow the rule of 3-1-2. So the big muscle, okay, you should draw it enclosing all the muscles. It is the soleus, and there is pretty much importance of soleus. Okay, so you have to draw this venules in soleus. Okay, some venules like this. So why soleus is important? Soleus is also known as peripheral heart. I will discuss in a short while. Just let me draw the 2 muscles, the 3-1-2, complete the 3-1-2 rule. So basically the 2 muscles are like this. Okay, this is the medial head of gastrocnemius. Remember the popliteal fossa. Okay, and this is the lateral head of gastrocnemius. So when coming from deep to superficial, we must first see the most medial muscle, the flexor digitorum longus. The middle muscle is the tibialis posterior, and more lateral is flexor hallucis longus. Coming more superficially, we have 2 muscles, the 1 muscle, the peripheral heart, the soleus, and more superficial is the 2 muscle, the lateral and the medial head of gastrocnemius. Okay, now we said that soleus is the peripheral heart. So what happens is, soleus, when it contracts, okay, so it is the main muscle for venous return from lower limb. Okay, it is the most important muscle for venous return from lower limb. So basically when soleus contracts, all the blood in this venules, like we draw this venules, okay, from this venules it basically get pumped back to the right atrium, like directly to the, not to the direct right atrium, but it ascends upwards and further it ends in the right atrium. So basically the soleus when contracts, the venous return from the lower limb is sent to the heart. Okay, therefore the soleus is known as the peripheral heart. Okay, so also soleus, the importance, one more importance of soleus, gastrocnemius and the soleus are the main muscles in walking. So why? So soleus acts as the first gear in walking and gastrocnemius in the second gear. Okay, so basically when we walk, soleus is the most important muscle. Remember like this. Okay, so no need to write it, but it is a kind of like it is a logic to apply. Okay, then when we come to the tendocalcaneus joint, okay, so the tendocalcaneus joint, one I will like to mention the point. Tendocalcaneus joint is the strongest tendon in body. Okay, so basically tendocalcaneus joint is basically the tendons of, so in simple words, tendons of gastrocnemius, both the head, okay, and soleus together form the tendon of the strongest tendon in the body, the tendocalcaneus joint, and it attached to the calcaneum, so it is known as tendocalcaneus joint. Okay, and in tennis player, the tendocalcaneus joint gets oftenly gets damaged. Okay, in case of tennis players. One more applied to discuss in the leg, it is very important, the tarsal tunnel syndrome. So this may be the last part of this video, the tarsal tunnel syndrome. Okay, tarsal tunnel syndrome is basically tibial nerve damage. Okay, damage to tibial nerve. So basically the tibial nerve, what it supplies the flexor compartment. So basically flexor compartment affected. So if the flexor compartment is affected, okay, so what will be the position, what will be the, if the flexor muscles are done, okay, the flexor muscles are gone, so what will happen? So we will get a dorsiflexed foot. Okay, now the tibial nerve can be damaged in the upper part, the middle part of the the upper part of the tibia, then the middle part of the tibia, and in the flexor retinaculum. So if now it gets damaged, somehow it gets damaged, so there will be sensory loss. Okay, sensory loss where in the distal and middle phalanges, okay, including the nail beds. Okay, distal and middle phalanges, also the nail beds. Okay, and also the sensory loss all over the foot. Okay, now the motor loss, what will be the motor loss? The muscles of calf. Okay, motor loss, muscles of calf region. Okay, if now there's a catch, if there is tibial nerve injury, let me just mention it here, tibial nerve injury is in the upper part, then only the motor loss will be observed. Okay, and if the the lower part and the middle part, so generally we do not get the motor loss. Okay, now one important point, the Tinel's sign. What is this Tinel signs? Okay, so basically it is a procedure where we tap on the flexor retinaculum, which is present more medially. Okay, so when we tap, on the flexor retinaculum, what is the effect? We get numbness of skin, numbness and tingling sensations on skin of medial side of heel or the medial side of leg, let be specific, the heel, and also sole. Okay, so numbness, the tinel sign, when we tap on the flexor retinaculum, we get a numbness on the medial side of leg or medial side of heel and also the sole. So that's it for today. Thank you.